Lymph, a clear, colorless fluid containing white blood cells, primarily lymphocytes, that circulates throughout the lymphatic system. It helps remove waste, toxins, and unwanted materials from the body while transporting immune cells to fight infections, diseases, and other harmful invaders like bacteria and viruses. Spleen, an organ located in the upper left abdomen that filters blood, removes old red blood cells, and stores platelets and white blood cells. It plays a crucial role in immune function by producing and activating lymphocytes to help the body fight infections, diseases, and other pathogens. Thymus, a small gland behind the sternum where T lymphocytes mature. Essential for adaptive immunity, it helps develop immune tolerance and fights infections. Most active in childhood, it shrinks in adulthood as other organs take over its function, but it remains important for immune responses. Lymphocyte, a type of white blood cell crucial for immune defense, including B cells that produce antibodies and T cells that destroy infected or abnormal cells. Found in blood and lymphoid tissues, they help recognize pathogens, trigger immune responses, and provide long-term immunity against infections. Lymph nodes are small, bean-shaped structures scattered throughout the body that filter lymph fluid, trapping pathogens, cancer cells, and debris. They contain lymphocytes and other immune cells that help detect and destroy harmful invaders, playing a key role in immune system function and infection defense. Tumor, an abnormal mass of tissue that forms when cells grow uncontrollably. Tumors can be benign, non-cancerous, or malignant, cancerous. Malignant tumors invade nearby tissues and spread through the bloodstream or lymphatic system, requiring treatment like surgery, chemotherapy, or radiation to prevent progression. Virus, a microscopic infectious agent that invades living cells to replicate. Viruses cause diseases like the flu, COVID-19, and HIV. They consist of genetic material inside a protein coat and rely on host cells to multiply, often triggering immune responses or long-term health complications. Monocyte, a large white blood cell that plays a role in immune defense by engulfing pathogens, dead cells, and debris. They circulate in the bloodstream before migrating into tissues, where they transform into macrophages or dendritic cells, helping to regulate immune responses and inflammation. Computed refers to computed tomography, CT, an advanced imaging technique using X-rays and computer processing to create detailed cross-sectional images of the body. It helps diagnose diseases, detect tumors, guide surgeries, and monitor treatment effects, providing clearer and more accurate medical imaging than standard X-rays. Contrast, a substance injected or ingested before imaging tests like CT scans or MRIs to enhance visibility of blood vessels, organs, and tissues. It improves diagnostic accuracy by highlighting abnormalities, tumors, or infections, allowing doctors to differentiate between normal and diseased structures more effectively. Chemotherapy, a cancer treatment using drugs to kill rapidly dividing cells or stop their growth. It targets cancer cells but may also affect healthy cells, causing side effects like nausea, hair loss, and fatigue, often combined with surgery or radiation for better treatment effectiveness. Radiation, a cancer treatment using high-energy particles or waves like X-rays or gamma rays to destroy cancer cells by damaging their DNA. It can shrink tumors, relieve symptoms, or eliminate cancer entirely, but may also affect healthy tissues, leading to side effects like skin irritation or fatigue. Lymphoma, a type of cancer that begins in the lymphatic system, affecting lymphocytes, a type of white blood cell. Lymphoma can cause swollen lymph nodes, fatigue, fever, and weight loss. Treatment often involves chemotherapy, radiation, or stem cell transplants, depending on the type. Lymphangiography, a diagnostic procedure using X-rays and contrast dye to visualize the lymphatic system. It helps detect blockages, tumors, or other abnormalities in the lymph nodes and vessels. Lymphangiography is typically used to investigate conditions such as cancer, infections, or lymphatic diseases. Mononucleosis, a viral infection commonly caused by the Epstein-Barr virus, EBV, known as the kissing disease. Symptoms include fever, sore throat, swollen lymph nodes, and fatigue. Mononucleosis is spread through saliva and usually resolves on its own with rest and symptom management. AIDS, acquired immunodeficiency syndrome, is a late stage of HIV infection where the immune system becomes severely weakened. It increases susceptibility to infections and certain cancers. AIDS is preventable and manageable with antiretroviral therapy, ART, though no cure currently exists.